In the first seconds of a major earthquake, chaos strikes. Structures collapse. Things fall from ceilings, walls, and shelves. Glass shatters. And people get knocked off their feet. Most injuries happen fast. It's a lot all at once. Would you know how to respond in an emergency medical situation after an earthquake? I'm the Preparedness. I created this series with the major earthquake in mind, though the emergency preparation steps you take to prepare for that will also have you ready for most other potential crises or disasters as well. Let's look at the types of injuries you're most likely to deal with, what kind of first aid supplies to get and why, and which training courses are worth taking, so you can feel more confident helping yourself and your loved ones when it really matters. According to researchers, the most common injuries in developed countries during a major earthquake are soft tissue injuries, which are basically anything that isn't a broken bone. Think cuts, bruises, and sprains. Broken bones are also common. And then there are crush injuries, when someone gets trapped under heavy debris. After the shaking stops, unfortunately, the danger doesn't. Fires can break out from damaged power lines, electrical wiring, and household appliances, or from gas leaks, which means burns become another concern. And all that dust, plus smoke from fires, it can cause breathing problems, particularly for people with asthma or other respiratory issues. So there's a real need for first aid, especially when hospitals might be hard to reach because of damaged or blocked roads. As bad as it all sounds, try to look at the bright side. Here's your moment to be the hero you've imagined yourself to be. Oh, maybe that's just me. Anyway, what kind of first aid supplies should you have on hand? That depends on your training, comfort level, and how many people you're preparing for. If you've had little or no training, I recommend a basic kit. I'll put an hourglass next to all items that have an expiration date. Be sure to write those down in one place to keep with your kit and set a reminder for when you need to replace those items. And another note, the American Society for Microbiology now acknowledge that using topical antibiotics may kill beneficial skin microbiota and slow down the wound healing process. So, alcohol wipes and antibiotic ointments, though often included in first aid kits, are discouraged by many medical associations. Include a 90-day supply of your regular daily vitamins and supplements, as well as your ongoing prescription medications. Also add things specific to the medical needs for your household members, such as an EpiPen or glucose gel. Let's talk tools. Here's what to include in your DIY earthquake first aid kit: a thermometer, tweezers to pull out smaller embedded objects, and trauma shears for cutting bandages or clothing. For over-the-counter meds, include acetylsalicylic acid, such as aspirin, for pain relief when there's no bleeding involved. By the way, it's no longer recommended to give someone aspirin when a heart attack or stroke is suspected, because it may actually be a torn aorta, stomach ulcer, or ruptured blood vessel, and aspirin would make all of these worse. Include acetaminophen, such as Tylenol, for pain and fever relief. It's the only over-the-counter pain reliever that's safe to use when there's a lot of bleeding. Ibuprofen reduces pain and fever, but because it can cause so many complications across a variety of areas, use it with caution. Diphenhydramine hydrochloride, such as Benadryl, for non-life-threatening allergic reactions or seasonal allergies. Probiotics, since you may be under a lot of stress and eating foods you're not used to. Calcium carbonate, such as Tums, for heartburn. Bismuth subsalicylate, such as Pepto-Bismol, to help alleviate gastrointestinal discomfort. Hydrocortisone cream for itchy skin due to bug bites, stings, or rashes. Electrolyte powder, such as Liquid IV, for hydration. Supplies for you to use while you're treating someone: personal antimicrobial wipes and hand sanitizer to clean your hands before and after treating wounds, and personal protective equipment like nitrile gloves, N95 masks, goggles, and an apron. And supplies for treating the person: saline solution for cleaning wounds. It may also be used to moisten dry gauze that is put in or against a wound, or as an eye wash. You may use potable water if saline solution is unavailable. Povidone iodine, aka betadine, use only if there's a high risk of infection, as it can delay healing. A selection of adhesive bandages in various sizes and shapes for small wounds. Combine pads for medium to large wounds. A roll of gauze to wrap combine pads or to wrap other dressings or wounds. A triangular bandage has multiple uses, including as a sling, a cover for head wound dressing, or as a tourniquet. Self-adherent tape to secure dressings, for compression, or to immobilize joints such as ankles or wrists. Cloth tape is good for securing splints. Instant cold packs to reduce pain and swelling. And a space blanket to keep the patient warm and prevent shock. There's lots more to cover, but first, a reputable source for these supplies is Chinook Medical, and 2 pre-made basic kits I recommend. One is a decent budget kit, the General Medi 2-in-1 First Aid Kit, and a more comprehensive kit is the MyMedic MyFac Standard Kit, and I'll include a link in the description to give you 20% off. If you get a pre-made kit, be sure to open it and get familiar with where different items are stored. When the shit hits the fan and you go into fight, flight, or freeze mode, your logical brain power is reduced. You don't want to have to be searching your kit or reading through a first aid manual at a time when seconds are critical. More items can be added for a more advanced kit if you or a member of your household have the training or knowledge to use them. If you're finding this helpful, subscribe. You'll get notified when I post the next video, and it also helps more people discover this information. Larger wounds need to be kept moist and less infected. Signs of infection are when the exudate or wound secretion is thin and cloudy, or thick and either yellow, green, tan, or brown in color, and when there are red streaks on the skin around the wound. There are several types of wound dressings. Here are 3 of them. If you see signs of infection, use silver alginate dressing to help fight it. For wounds with life-threatening bleeding, there are hemostatic dressings, like Quick Clot Z-Fold. Hydrogel-impregnated gauze is good for burns and drier wounds, to keep them moist to promote healing. A compression bandage is good for immobilizing sprains or to help control bleeding. Splints, get the size for fingers and the bigger one for legs and arms. A cat tourniquet, along with a Sharpie pen, to write the time the tourniquet was placed to ensure it's removed within 2 hours. Emergency trauma dressing keeps the wound under pressure. A neck collar if you need to immobilize the neck. A bag valve mask or CPR mask for protection while administering resuscitation. A vented chest seal to seal a chest wound and help the patient breathe. And an AED if you really want to get advanced, especially if you plan to help a large group of people. I'll cover training options in a moment. A reputable source for these advanced items is North American Rescue, and I'll include a link in the description. A couple of advanced kits I recommend are a budget one called CareTac Tactical Trauma IFAC, and a comprehensive one, the MyMedic MyFac Pro. And an advanced pre-made kit I recommend for a group of people is the Medic from MyMedic. Now for training. Some training classes to consider in the U.S. Stop the Bleed, a course by the American College of Surgeons. Almost every type of common injury in an earthquake can involve bleeding, so knowing how to stop it is very important. They have an online course at stopthebleed.org, and you may also find in-person courses if you search for Stop the Bleed training in your area. I'll put a link to their site in the description. A CPR class shows you how to spot symptoms of heart attack and how to perform chest compressions and rescue breaths. It's offered by many organizations, and some fire stations even offer it for free. And it's well worth the investment either way. First aid classes cover general first aid, and they're sometimes combined in a CPR and first aid course. A CERT class, which stands for Community Emergency Response Team, includes triage, medical aid, search and rescue, and other disaster-related topics. These courses are essential for anyone creating a disaster preparedness plan or stocking an emergency medical kit. Thanks for watching. The next video will be about what I call the get-home bag, but you may know it as a bug-out bag or go bag. Until then, be prepared, not scared.